everybody, my name is Cassie Huntsman, and today I'm going to be talking to you about strep throat. Strep throat is caused by the Streptococcus group A bacteria. The Streptococcus group A bacteria is also the most common cause of bacterial pharyngitis as well as scarlet fever. Strep throat itself is highly contagious. You can obtain strep throat through the air as well as through touch. So if someone were to sneeze or cough while standing next to you and they have strep throat, the air particles, if you're breathing them in, you will develop strep more than likely. I believe the incubation period for strep throat is 3 to 5 days. So even though you have strep, you may not feel symptoms until the 3 to 5 day period is fully incubated. Strep throat is also obtainable through touch. So if you were to touch a doorknob after somebody who has strep and you were to rub your mouth or your nose or rub your eyes, you can also obtain strep that way. The symptoms of strep are very noticeable. You can develop a sore throat, and you can have trouble swallowing and pain when you swallow. You also develop a very high fever of over 101 degrees Fahrenheit. Strep throat can also cause your tonsils and your lymph nodes to swell. And there are also unmistakable yellow or white pus pockets that can develop on the back of your throat if you have strep throat. They will be on the back and your throat will be extremely red. There are less common symptoms as well. I personally developed horrible headaches when I have strep, and those are the lesser common symptoms, so I believe it just depends on who you are. Other symptoms include vomiting, body aches, loss of appetite, and you can break out in a rash also if you have strep throat. There are long-term effects that can develop if strep is not handled properly or at all. Rheumatic fever, otitis media, which is when the infection from your throat will spread to your inner ear and it could cause severe damage to your eardrums. Meningitis, pneumonia, and toxic shock syndrome are also other things that could develop over a period of time if you do not handle the strep throat that you have. Strep throat can also damage your organs. It can affect your organs directly, such as your kidney. It can cause your kidneys to swell. And also, if you do not take care of it and you develop the rheumatic fever, that will cause inflammation on your heart, your joints. It can cause inflammation of your nervous system and your skin. It can be extremely dangerous and should be handled effectively and as soon as possible if you notice that you do have strep. Strep also attacks the tissue inside of your throat, which is what would cause the pain and the sore throat and the trouble swallowing due to the infection attacking your throat. It will cause it to be inflamed and irritated. There are treatments for strep. It is a fairly treatable sickness. You will take oral antibiotics prescribed by your doctor, and the oral antibiotic typically will help your symptoms not be so severe. It'll make you feel a little bit better. It may not take the symptoms completely away, but by lessening the symptoms, it will make you feel slightly better right away. It is very important to take the oral antibiotics and to make sure you finish them, because if you cease to take the antibiotics too soon, severe complications can develop, such as the long-term effects that I spoke of earlier, the rheumatic fever, the pneumonia, meningitis, and those all can be extremely dangerous to your health, and that is not good. It is extremely important, like I said, to make sure you take all of the oral antibiotics unless directed by your doctor. That would be the most effective way to handle your strep. Prevention of strep is possible. It is very common, like I mentioned earlier, in school districts and daycares, so it's very important to wash your hands and make sure your hands are clean, and make sure if you are around somebody that does have strep that you are washing your hands often, because like I said, touch is very important, because if you touch your mouth or your nose or your eyes, you can come in contact with the strep bacteria and it will enter your body that way. It is important not to eat or drink after anyone that has strep, due to the fact that the bacteria could easily be transmitted that way. But that's pretty common sense for any kind of disease. It's also very important that you make sure to wash any contaminated objects such as bowls, cups, plates, or even blankets that the person who has strep is using. So that way the bacteria and the disease that is on those are basically washed away. It is extremely important to use hot soapy water to clean everything, just like your hands. You're going to want to wash your hands, you're going to want to wash everything that they come in contact with, and that would be the best way of preventing strep. Thank you so much for watching this video, and I really appreciate the time that you've taken. My name is Cassie Huntsman, and this was Strep Throat.